The fifth hour of structural integration is somewhat like the first hour, but on a deeper level. This is a good chance to take a look at your work, do a nice postural assessment, stand back and see how it looks, and see what you might need to be doing in the future sessions. So the 5th, 6th, 7th sessions, so that you can get an idea about by the time you get to the 8th, 9th, 10th sessions, a lot of the work has already been completed and you can fine tune things. You can go back and do your finish work in those later sessions. So do the work now so that you don't have to do the work later. So 5th hour, again, you're checking the person's primary and secondary and tertiary breaths. You're seeing that held in them, if it stayed there, if it took hold or not. So you're reinforcing that. You're also working the diaphragm again. And you're also going into the psoas in this session. So the psoas is a deep hip flexor and it attaches to the lumbar vertebrates and it runs down and inserts onto the head of the femur. So it's a powerful hip flexor. It works in conjunction with Quadratus Lumborum. They work together. If a person has kyphosis or anteriorly tilted pelvis or a posteriorly tilted pelvis, you can get a lot of relief by releasing the psoas muscle. So to do that, you have to work deep down into the anterior spine. The 5th hour is a good place to start on the arms as well. Sometimes, if you have time, depending on the person, the arms can be difficult, especially if they've had a previous injury, rotator cuff injury or frozen shoulder injury or something like that. It can be very difficult to get release on that. It's a good hour to spend a little time on that. And it's important to also work the subscapularis muscle on the anterior side of the scapula. It's a difficult muscle to get to, but it's a really important one for releasing. A lot of times there can be trigger point referrals in there. Pain pattern referrals means you're pushing on one place, but you're feeling the pain in another place. The pain is not coming where you thought it was coming from. That's a pain pattern referral. So this is a good hour to get the subscapularis. If you have time, you can take a few minutes and work around the belly button, the navel, the place where the umbilical cord connected us to the mother. It's a powerful position in the body because it represents the connection to the mother. Sometimes you'll see fascial pullings being one way or the other. Or sometimes if people have intestinal problems in that region, it could be an indication that there's some unresolved issues around the mother. So it's good to take a few minutes and work around the area, see what you find. It's also good to go down to the pubic symphysis and see if there's any remaining hypertonicities or adhesions or emotional holding points that could be released there. And then in addition to that, if you have time, to do the muscle energy technique on the pubic symphysis and see if you can get a readjustment on the pubic symphysis. If not that, maybe you can get some adjustments on the hamstring insertions or the adductor insertions along the pelvic floor. So 5th hour is a good opportunity to integrate the upper and lower halves of the body. It's a good opportunity to work with the middle portion of the body and see if we can create more homeostasis between the upper and the lower and the left and the right and the top and the bottom. So it's an important hour in creating the balance between the uppers and lowers. So that's why we focus on psoas, abdominals, hip flexors. So in session 4, we worked on the pelvic floor. In session 3, we worked all around the head of the iliac crest. In session 2, we worked the low leg. And in session 1, we worked all the intercostals, diaphragm, abdominals as well. So by this point, you should be able to work deeper on your client. You should have the communication with them where they understand that it's important to breathe and to allow you, to give you permission to go into the deeper layers. Because if they don't give us permission to go in, we can't go in. For example, if they're holding or just whatever reason, subconsciously, maybe they're doing it, they don't realize it. So it's good to ask them to go ahead and give you permission so that we can do our work. And normally they let you in. So it might take a little communication on that level.